we move to the upward, means that is the lower genital tract infection, and the upper genital tract infection is called PID, that is the pelvic inflammatory disease. A very common topic that we are going to see in day to day are OPDs. So what is PID? PID is a disease of upper genital tract. It is the infection and inflammation of the upper genital tract organs. Infection of the uterus is called endometritis. Here it's a wrongly written. Infection of the uterus is called endometritis, not endometriosis. So infection of the uterus is termed as endometritis. Infection of the fallopian tubes are called salpingitis. Infection of the ovaries leads to tubovarian abscess, and pelvic peritoneum infection cause pelvic peritonitis. These are the terminologies basic that we should know. What is endometritis, what is salpingitis, what is tubovarian abscess, and pelvic peritonitis. Now the risk factors. What are the risk factors of the PID? The PID is mostly seen in the menstruating teenagers, multiple sexual partners, and IUCD users. So PID किसमें होता है? So it is mainly seen in the menstrual teenagers who cannot keep the hygiene of the private parts, those having multiple sexual partners, and those having long-term usage of IUCD. The most common organisms we encounter in the PID are gonorrhea, chlamydia, and the Mycoplasma hominis. The most common organism are mainly two, gonorrhea and the chlamydia. Others are streptococcus, staphylococcus, and the E. coli. Symptoms. How they present to you? So they are present with bilateral lower abdominal dull ache pain. How the PID patient present to you? The patient present with bilateral dull aching, continuous lower abdominal pain. If it's associated with endometritis, means infection of the uterus, it is associated with irregular excessive vaginal discharge. Sometimes it is with abnormal vaginal discharge, nausea, vomiting, dyspareunia, acute PID can present with fever and the lethargy. So how they present to you? So PID patient mainly comes with this kind of complaints: bilateral lower abdominal dull aching pain, irregular excessive vaginal discharge, abnormal vaginal discharge, nausea, vomiting, dyspareunia, and acute case can present with fever and the lethargy. In severe case, patient may have pain in the right hypochondrium. It is called Fitz-Hugh-Curtis syndrome. Sometimes, due to PID, this chlamydia can also affect the liver. And adhesions you can see when you do the laparoscopy. Then when the liver is involved due to gonorrhea or the chlamydia, in case of PID, it is called Fitz-Hugh-Curtis syndrome. Signs. How can you confirm? Per abdomen, tenderness on both quadrants of the lower abdomen. On vaginal examination, first always PID start with vaginal infection, and then gradually organism grow upwards into the upper genital tract. So patient mostly have the vaginal infection along with PID, so they have purulent vaginal discharge. The congested vaginal wall, cervical opening, urethral opening. On bimanual vaginal examination, there is a tenderness in bilateral adnexa. What is adnexa? What do you mean by adnexa? See, this is Yeah, fornices. This is uterus. Okay. This is fallopian tube. And this is ovary. Okay. So the whole this portion, when you feel from outside, this is called adnexa. So when you do the bimanual vaginal examination, you can feel tenderness in both fornices or both adnexa due to congestion and inflammation of the uterus, fallopian tubes and the ovaries. So that is main the sign of PID. So there is a bilateral adnexal tenderness present. How you confirm the diagnosis? First, mainly with the symptoms and the signs. In every case, we don't go for investigating part in each and every case, because sometimes by the symptoms and the sign, you can conclude that it's a typical case of PID. Typical complaint of lower abdominal dulking pain since 2 to 3 months, associated with purulent vaginal discharge. And on examination, if you do the bimanual vaginal examination, if bilateral fornical tenderness are there, 80% chance of it is a confirmed case of PID. Now you want to confirm it. Then you can confirm. First, send the vaginal swab culture for sensitivity. Can go for the USG pelvis. What you will going to see in the PID? In PID, there is a peripheral dilated vessels. The vessels in the pelvic organs are dilated. Blood, due to infection and the inflammation, there is an increased WBC count. And the most reliable diagnostic criteria is is the laparoscopy. आप लेप्रोस्कोपी करते हो तो इसमें पक्का आपको ऑन विजुअलाइज पता चल जाता है कि यूट्रस इज बिकम रेड, हाइपरेमिक, कंजेस्टेड, fallopian tubes and the ovary. You can see that fixed Curtis syndrome, chlamydial involvement in the lower surface of the liver. So laparoscopy is the confirmed diagnostic test for PID. Complication: if we don't treat the PID, what it can cause? Immediate. Please. हम्म हाँ, आ जाता है समझ में। जो करते हैं ना, जो जो लोग अल्ट्रासाउंड करते हैं तो इतनी बड़ी-बड़ी वेसल्स, या बड़ी-बड़ी वेसल्स दिखती है। आप डिफरेंशिएट कर पाते हो। अल्ट्रासाउंड में आप टिपिकली देखते हो तो वेसल्स जो होती है डॉपलर लगा के देखते हो, या ऐसे भी आप देखते हो तो पिक्चर पता चल जाता है कि एकदम हाइपरेमिक और कंजेस्टेड यूट्रस होगा तो आपको ऐसी पूरी उसकी इकोजेनिसिटी है ना वो अलग दिखेगी। तो यू कैन कंक्लूड द डायग्नोस्टिक बिकॉज और कई बार अल्ट्रासाउंड में वो लिख के भी आता है कि पेरिफेरल डायलेटेड वेसल्स, सो सजेस्टिव ऑफ पीआईडी। और अदरवाइज ट्यूबोवेरियन एब्सेस होगा या ऐसा कुछ होगा तो वो तो लिखेंगे, पर अगर माइल्ड टू मॉडरेट पीआईडी होगा तो उसमें द ओनली सिग्निफिकेंट फाइंडिंग इज डायलेटेड वेसल्स। ओके। Then the complications. Sometimes patient may present with acute case of the PID. If it's remain untreated, rarely it can leads to the pelvic peritonitis, general peritonitis, septicemia, and the septicemia can occur. Late complications. It because of the PID, it leads to dyspareunia, infertility, chronic pelvic pain, and increased chance of the ectopic pregnancy. It's a very common. When you found the ectopic pregnancy, most 70% of that patient are suffering from the PID. Why? Because PID, what is PID? It is the infection and inflammation of the uterus, fallopian tube and the ovary. So because of infection and the inflammation, there is a ciliary movement in the fallopian tube is affected. So that's why egg from the ovary to the uterus can't easily go. So that's why, because of affected ciliary movement, eggs get trapped into the fallopian tubes and there is a more chance of the ectopic pregnancy. So usually if the PID case is there, first you have to give the proper antibiotics for to treat the PID and then go for the infertility management. Otherwise that patient may end up into the ectopic. Because of the PID, patient don't know and patient not seek the medical advice. Long PID leads to the adhesion, frozen pelvis and leads to the chronic pelvic pain syndrome. PID, because of infection and the inflammation, motility, ciliary movement of the fallopian tube affected, it can lead to the tubovarian abscess, uterus is congested, so that's it leads to the infertility. So these are the complications of the PID. So better is to treat in the early stage, because if you treat in the early stage, then outcome would be good. Now the management part. Mostly we do the OPD management in case of the PID over the IV antibiotics. The most common prescribed drugs, there are different kinds of the regimen. So इनमें से according to the patient need, according to the patient criteria, you can choose any of regimen. The first regimen is Levoflox 500 milligram daily or Oflox 400 milligram daily with or without metronidazole for 14 days. 14 days is most important, because what I have seen, many people giving antibiotics to the patient, but they give only for 2 to 3 days, yeah, 4 to 5 days. But there is a certain typical criteria. So if you confirm it's a case of the PID, at least 10 to 14 days treatment is required. So first regimen is Levoflox or Oflox with or without metronidazole for 14 days. Clear? First, this is the first regimen. Then sometimes if the patient have severe pain, what we do? We give the ceftriaxone injection IM straight and then followed by doxycycline 100 milligram BD for 14 days, or you can give the minocycline available in the market. Minocycline is the similarity to the doxycycline. It is very common drug used in the skin department, but here you can use, but my preference, because cynomycin and many preparations are available, but doxycycline standard dose, if you are using standard drug from the standard company, it's enough, because minocycline cynomycin tablets are available but they are very costly and there is no much more difference in the result. Then why should we patient have to pay more money? So doxycycline 100 milligram BD for 14 days is also the another option. So these are the main basic regimen. These are the regimen I have taken from the standard book. But what we